Hello and welcome to Pregnancy Info. Today we are going to discuss the side effects of epidural. The act of delivering a baby live up to its name, labor is hard and painful work. To make the experience more comfortable, women have a few options for pain relief, including epidurals and spinal blocks. We are discussing epidural block. For women in the United States, this is the most commonly used form of pain relief during labor. It combines analgesic and anesthetic pain relievers which are delivered through a tube in your back. The medication blocks pain signals before they can get to your brain. When you have had the injection, you will lose some feeling below the wrist, but you will be awake and able to push when the time comes. What are the common side effects of epidural? Common side effect ranges from itching to difficult urination. We will discuss them one by one in detail. Number 1. Itching. Some of the medications used in epidural, including opioids, can make your skin itch. A change in medication can relieve this symptom. Your doctor might also give you medication to relieve the itch. Nausea and vomiting. Opioid pain relievers can sometimes make you feel sick to your stomach. Fever. Women who get an epidural sometimes run a fever. According to PubMed Health, about 23% of women who get an epidural run a fever compared to about 7% of women who don't get an epidural. The exact reason for the spike in temperature is unknown. Soreness. After your baby is born, your back might feel sore, but the feeling should only last for a few days. Back pain is also a common side effect of pregnancy, as the weight of your belly puts extra strain on your back. Sometimes it's hard to tell whether the cause of your soreness is the epidural or residual strain from the added weight of pregnancy. Low blood pressure. About 14% of women who get an epidural block experience a drop in blood pressure. Although it's usually not harmful, an epidural block affects nerve fibers that control muscle contractions inside the blood vessels. This causes the blood vessels to relax, lowering blood pressure. Difficulty urination. After an epidural, the nerves that help you know whether your bladder is full will be numb. You may have a catheter inserted to empty your bladder for you. You should regain bladder control once the epidural wears off. What are the rare side effects? There are some rare side effects associated with epidurals, ranges from breathing problems to nerve damage. Breathing problems. In rare cases, the anesthetic can affect the muscles in your chest that control breathing. This can lead to slowed breathing or other breathing problems. Severe headache. If the epidural needle accidentally punctures the membrane covering the spinal cord and fluid leaks out, it can cause a severe headache. This only happens in about 1% of deliveries with epidurals. According to the American Society of Anesthesiologists, the headache is treated with oral pain relievers, caffeine, and plenty of fluids. Infection. Anytime you create an opening in the skin, such as with the needle, bacteria can get inside and cause an infection. It's rare to have an infection from an epidural. This is because the needle is sterile and your skin is clean before it inserted. However, it can happen. The infection can spread to other parts of your body too, but this is even more rare. Seizures. In rare cases, an epidural can trigger a seizure. If the pain medication gets into your vein, a seizure is shaking or convulsions due to abnormal electrical activity in your brain. Nerve damage. The needle used to deliver the epidural can hit a nerve, leading to temporary or permanent losing of feeling in your lower body. Bleeding around the area of the spinal cord and using the wrong medications in the epidural can also cause nerve damage. The side effects is extremely rare. It affects only 1 in 4,000 to 1 in 2 lakh people who have an epidural block, according to the American Society of Regional Anesthesia and Pain Medicine. Epidurals and assisted births. Having an epidural can increase the amount of time you spend in the second stage of labor. This stage starts when your cervix is fully dilated and ends when your baby is born. Women who have an epidural can spend an extra hour in this stage of labor. Talk to your doctor about the advantages and disadvantages of each technique. Medications provides the greatest pain relief, but it can cause side effects. Natural techniques will help you avoid side effects, but they may not cut through your pain. Make the decision based on your personal preferences and ability to tolerate pain. So, share this information with the friends who are going to deliver a baby and they might know about epidural and its side effects. And also follow my channel. Thank you. Take care. Bye bye.